Hello everyone, my name is Jenny and this is WSPT University's Lumbar webinar. We're going to get started with Mike DelGrosso and Lillibeth Gonzales right now.
Sorry, I lost my spine. Yeah, that's the last back joke, I promise.
I got a request.
Request, sure.
Can we get seats for old people instead of young people?
That's tough. It's hard to get recliners in clean here. I don't know.
A little higher.
A little higher.
At least 6 inches higher or something.
Not high to you.
A little higher.
I'll have to put that request in
It's
with
for us old guys to get up on.
to tell upper management about that. I'm teaching a back class and I'm having everybody in poor back posture, right?
Right.
I know. And that's the last thing I want to sound like is a hypocrite and have people in uncomfortable positions, right? Well, hopefully the next time it'll be better chairs. I'll tell Jenny about that. Okay, so anyway, just to give a brief overview about our educational series, and come have a seat if you like. What we basically do every month is on the last Thursday of the month, we have an educational series. And what we do is it's a public information, public service that we do not just for our patients, but for the community. So anybody that is able to and that'd like to come for the seminars are more than welcome to come to them. And really what their main purpose is really to keep people informed about their own health. And it's my philosophy, my theory that the more people are informed about their own health, the more they'll feel better. And that's important to keep your wellness and feel better and feel more well and to keep that wellness. That's the important thing. And the more people are informed about that, the more they're able to correct certain things and certain activities that they're doing throughout the course of their day, whether it's sitting in a low chair and in a compromised position, sitting in an office, looking at a computer screen 10 to 12 days, to somebody that's doing construction work, or somebody that's just taking a casual walk down the street. Certain things that we do, sometimes without even realizing, can compromise our own health and compromise the structure of our body. So the more that we're informed about that and make those changes, the better that we'll feel and the healthier we'll be throughout our lives. Because a great thing about modern medicine is that people are living longer, and because of advances in science and technology, that's taking place. But people also have to keep in mind with staying older, you also have to stay in good shape and staying fit, because a lot of those joints that we have through our skeletal system, our muscles, will deteriorate because of any moving structure, any mechanical structure with time will deteriorate. So we want to keep ourselves, like I give the analogy, as a fine-tuned and oiled machine, and we have to keep maintaining that machine and keep up with the maintenance. So the more we're doing that, the longer we'll live and the better we'll feel with that, with the advances in science and technology and our age. So we're just going to go through a few facts about the low back first, and then we'll talk about some of the anatomy and some of the physiology behind that. Jen, is this right? Press the arrow, forward arrow. Okay. Well, let me give you just a couple of facts about the back itself. So, let me ask you guys a true or false question. Does back pain affect only one group of people, or the elderly?
Everyone.
Everyone. So it's a broad range of ages. People in their teens can be affected by back pain, just as somebody in their 80s or 90s can be affected by back pain. It is actually the #2 reason why people go to the doctor for back pain. #1 reason is upper respiratory infection, but but the number 2 reason is back pain. So it affects a great number of people. At any given time, there are between 30 and 40 million people that are affected by back pain. So that's a significant amount of people. And because of that, we notice that there's a decrease in productivity. So a lot of these 30 to 40 million people are working people. So it's very hard to work in a position when you have back pain. So because of that, it's also one of the major reasons why people miss work, because they call in with back pain. And why is that? Can anyone give me an answer? Why is it hard to go to work, whatever work you're doing, if you have back pain?
Science movement hurts.
Right. Because right. Let me give you a little bit of information about the pressure that we place on our back. And this is a study that's been shown why it's very hard to move or stand or sit if you have back pain. I had a statistic. Okay, there we go. So if you're sitting down, or if you're sitting down in a hunched over position at a desk, you're actually putting 200 pounds of pressure on your low back. Now, if you're standing with a leaning forward position, you're actually putting, again, 200 pounds of pressure. So sitting with your shoulders arched and leaning over a computer desk, you're putting a lot of pressure, at least 200 pounds. And if you weigh over 200, it goes above that also. Now, if you're sitting without leaning forward, that pressure decreases to about 100 pounds. Laying flat on your back, you actually weigh, or you're putting 55 pounds on average on your back. So that shows you that whether you're sitting down, whether you're standing, if you have a compromised back, if you have back pain, it's very hard to function. So that's why a lot of times people aren't able to perform their various duties or responsibilities if they have back pain. And people will spend up to $50 billion a year on relief from back pain. And this is on aggregate between those 30 to 40 million people a year. It's being spent, or people are spending that total amount on back pain. And one of the most causes or common causes of back pain is the sciatica and radiating pain down one of the legs. So that's another reason why people can actually compromise their work or what they're able to do. So it's important that people, the more educated they are, the more they'll be efficient at their job, and it'll be better for the overall community of people, for the society, especially now that everybody's talking about increased healthcare costs. One way of doing that, and which is what we like to promote, we're not just a physical therapy clinic, but we're a health and wellness clinic to really help people stay well and continue being well throughout their life so that they can become more efficient. Okay. So let's go over just a little bit of the anatomy of the lumbar spine, and then we'll get to why people end up getting back pain. So if you know a little bit about the anatomy and the physiology, to kind of explain some of that to us. So basically, the lumbar spine is made up of the last 4 segments of the back. So can anyone name to me the main 3 segments of the spine?
Cervical, thoracic, lumbar.
Okay. Cervical, thoracic, and lumbar. Okay. Now, it's interesting that the lumbar spine is the widest. Can anyone tell me why it's the largest and the widest? Raise your hand, show of hands, or...
Much more pressure on your body in that area?
Okay. Yeah. Because we're putting a majority of our body weight through the lumbar spine. The neck is at the least, it's the most narrow because it's only supporting our head. Thoracic is supporting our chest, rib cage, vital organs. And then our back really supports everything from the waist up. So you really need a lot of width and a lot of structure for the back. And that's why, a lot of times people end up getting back pain because of all the compromised movements of your upper body and sometimes with your lower body, what we do with that. So what the back is made up of, or the lumbar spine is made up of, is the body, the front part. So this is the front of the body if you're looking at it this way. And we can all feel our spinous process, that bony prominence in the back of the spine. So even if you put your finger in your back and you feel those lumps there right in your spine, those are actually these bony prominences called the spinous processes. So they're kind of the protection for the spine, because what's behind the spinous process is vital to our body. It's the spinal cord, which goes from the brain all the way down to our sacrum. So the spinal cord is being protected by the spinous processes, which is a bony prominence, so that in case we fall on our back, if we make, or somebody hits us from behind, we're not actually causing damage to the spinal cord. Okay, so the back is actually made up of, or the lumbar spine is made up of different joints. They're called facet joints, and that allows us to move in different positions. So these joints in between here allow the back to flex forward, so bending forward this way, lean back, side bend to one side, to the left, side bend to the right, and then rotate from side to side, or that twisting movement. So that's why these joints are also really important. So if there's anything that's compromising these joints, that can actually have an effect on the way you move. Bending forward, side, or rotation can actually cause you a lot of pain if you have an injury with one of those joints. The discs, and everybody who's using that word, everybody knows about the discs. Sometimes people don't really understand what the purpose of having a disc. Everybody hears, oh, I have a blown disc, or my disc is moved out of place. Does anyone know what the true function of a disc, or an intervertebral disc, is in the lumbar spine? Good. Good. It's a cushion. Yeah, it's a shock absorber. It's a cushion. It's a protection, really, for the whole spine. We really don't want our two bones from any segment of the spine to start putting pressure on each other. Because by doing that, you actually may end up causing a fracture, you may be causing arthritic changes. So, yeah, both answers are correct. Shock absorber, when we're moving up and down. And also, it's a cushion, so that when we're moving, we're not getting one bone rubbing on top of the other bone. And it's also a protector for the spine and the spinal cord, so that when we're moving, if we're flexing forward, flexing back, the bone is actually not putting pressure on the spinal cord. There's that gap right between there. And it's a gap also for the nerves coming out from the spinal cord. That's crucially important. That's why when you hear doctors saying, you have disc herniation or disc bulge or any type of condition involving the disc, if there's a problem with that, because of its significant importance to the spinal cord and the nerve roots, you can actually start getting sciatic type pain or radiating pain, nerve pain, because it's a protection for that area. And that's what the spinal nerves are. Spinal nerves either feed one leg, the left leg, or the right leg. And the biggest nerve in the leg, does anybody know the name of it? Sciatic nerve. Exactly. So it's a bundle of these small nerves here, the nerve roots, bunching together, and it passes right behind the leg. So that's when you hear people saying, I have sciatica, or an inflammation of the sciatic nerve, they'll feel the pain down the back side of the leg, maybe into the calf, into the toes, or underneath the foot. So that's where it all comes from. It starts right from the low back. So if you have any type of condition affecting those nerves, you'll have that pain radiating down the leg, tingling, numbness, weakness, because of the nerves themselves. We kind of talked about what movements the back makes. So it's, like I said, flexion, extension, side bending, rotation. And this slide over here kind of shows a little bit of the amount of movement that the lumbar spine makes. So this is the flexion extension movement at the lumbar spine, at the thoracic spine, at the cervical spine. The further out these bars go, that means that that segment has more movement in that area. So this first slide shows that flexion and extension, or bending forward and bending back, there's a lot of movement, especially at the lower part of the lumbar spine, of the low back. But then we go down, and we see that lateral movements, or side bending, not so much movement over here compared to the other parts, like the neck in both sides. And now, especially if we go down to rotation, we notice there's almost no movement at the lumbar spine, only a little bit at the very, very end. So So what significance is that? Well, it means that our body can be compromised, our back can be compromised if we do a lot of rotation or twisting movement with our back. Because there's not a whole lot of movement that the spine is made to do. The neck rotates a whole lot. We can rotate our neck from side to side. Functionally, we need that to, whether we're driving, whether we're looking or talking to somebody. Our back or low back, it really isn't made to twist and turn that much. It's really primarily used for bending forward, extending back, a little bit of side bend, a little side bend to the right. So what a lot of times happens with people, they make the mistake in rotating too much or twisting their back too much. I always tell people if they have back pain, some of the most important things to follow, especially after surgery, is no BLTs. It doesn't mean no sandwiches. It means no bending, lifting, or twisting. Especially that twisting part is really important because the twisting will actually, put, again, a lot of pressure. It'll force that back to go more than it should. So one of the most important things when you're lifting something, and I see this a lot, and I see this, I was telling a patient today, at my gym, I see people doing the worst possible movements. A lot of the lifting, and I see people with dumbbells lifting and yanking the weight up over their head and then yanking it back down, not knowing that they're really causing their backs a lot of pain, whether their backs or even their shoulders, but especially that twisting movement, lifting something heavy and twisting and then coming back up with that weight is one of the worst things you could possibly do for your back. So we'll go into that a little bit more, but this is one of the main physiological reasons why that's such a dangerous thing to do, because our body's just not made to do that. We're really not made to twist and lift anything too heavy. We have so many other joints that we should use and so many more muscles that we should use to do that. Some of the muscles that help with the back, and some of the main ones that everybody knows, are the abdominals, the six-pack. Everybody wants to get the six-pack. All these young guys, they go to the gym, and that's what they want to focus on. It's the main question: how do I get a six-pack? But there's some other. I'm not making the jokes this time. See? I told you it was only one back joke. But what's underneath the six-pack is, and I'm not going to say Bud Light, it's the transverse abdominal. So there are other muscles underneath these main muscles. There's the external oblique muscles. There's the internal rectus abdominal muscles. So those muscles themselves actually have to be worked on too to hold the spine nice and straight. And then there are the muscles of the back, your extensor muscles. Those are the muscles that allow you to stand up straight and to extend back. So those are also muscles that people sometimes tend to forget. And they're important because the spine, if you can think of it, it's a structure. It's a skeletal structure. But what really should be doing a lot of the movement are the muscles. They're the ones that are really taking the grunt of the movement, and they should be taking it because we don't want to put any extra force through these discs and start compromising the disc integrity. The stronger the muscles are around the spine, the less pressure you'll be putting on the spine itself. You want to almost solidify the spine, almost cement the spine into place so whenever you're moving, you're not really compromising any extra movement. What's taking the force of lifting or walking or bending or getting up out of a chair are the muscles rather than putting pressure on the spine and really trying to lift anything up. And that's why people that I see that try to lift anything heavy and start yanking on things, they don't have that muscle strength. So they're really putting all their pressure through their spine, through their skeletal structure, which eventually with time that'll start wearing away and it'll end up compromising pain and efficiency of that joint. So you want to really, and I've stressed that with a lot of people, and that's what we do with therapy is strengthen up a lot of those core muscles. That's why it's the key word, keeping your core strong for a long way. Okay, so now we can go through a few of the dysfunctions of the spine, and we kind of talked about a few of them. Fractures, and the primary fractures, or some of the main fractures that you'll get in the spine is either a stress fracture, and that comes with, a vertical compression load through the spine, through the axle, through the straight axis of the spine. So jumping off 10 feet, 20 feet, 30 feet, you can actually cause compression fracture through the spine. An extension fracture, which you can cause a fracture of the spinous processes, or an anterior body fracture, which bending forward too much and an abrupt force going forward can actually cause a fracture of the body of the lumbar spine. Now that's increased even more if somebody has osteopenia or osteoporosis. So our skeletal structure can take quite a bit, but if our bone density is very low, which is what osteopenia and osteoporosis is. Osteopenia is not so much, osteoporosis is very low bone density. If that's not up to par, where it should be, people are more likely to have fractures in their spine. Okay? Muscle strain and ligament strains, those are some of the main issues concerning whiplash. When you have whiplash, what it is, it's a forward and back movement of the spine, or sometimes a side-to-side movement, depending on where you get hit. Now, what happens a lot of times, people tense up most of the time when they are about to be involved in a motor vehicle accident. So since the muscles tighten up and you go through that whiplash, those muscles will actually tear, causing a strain of those muscles. And a lot of the ligaments that hold some of these skeletal structures together, because there are a lot of ligaments in the front of the spine and a lot of ligaments in the back of the spine. So if you overstretch the muscle, now you go into the ligament, those ligaments can also fail, and you'll have tears or sprains of those ligaments. And if you're involved in, or if a person's involved in a really bad motor vehicle accident, you can actually cause a disc bulge or a herniated disc. So, like I said, that's why these discs are so important, because if you really get a condition causing a disc bulge or a disc herniation, it can cause a lot of other problems down the road. Yeah.
What's the difference between a bulge?
Well, a bulging disc, and I can kind of show this picture right over here. It shows the difference. This is a normal disc right here, just like we're showing here on this model. It should be nice, it should be filled, and there should be a significant gap between the two vertebrae. And there should be a little bit of a gap right in here. You see these areas right in this white area between the two bones? That's where these spinous nerves or spinal nerves exit from the spinal cord. So this is a very important space. Since this is a degenerative disc, which means that that disc has now lost a lot of that fluid or that liquid inside the disc itself, it shrinks and it starts causing a compression of this space over here. Now, a bulging disc is just some of that liquid, which, this is a cutout version of what a disc looks like. There's a liquid right in here, and there's a ligament surrounding that liquid, holding the liquid in. That's that gel or that cushion. If some of that liquid starts pushing out against the ligament, but doesn't break the ligament still stays in place, that's called a bulging disc. It's bulging out of that area, but it hasn't broken the ligaments. It hasn't broken the outer layers of the disc, where it's actually cartilage around that area, not ligaments. So that's what that is. Now, a herniated disc is when that cartilage right here that surrounds that liquid actually breaks and it pushes out. And this is the spinal nerve right over here. So if you get a bulging disc, you see how that space is slightly compromised where that nerve is supposed to exit? This area is a lot worse because that liquid or that gel came out and now it's taking up a majority of that space where the spinal nerves are exiting. So if that happens, nerves are incredibly sensitive. So I don't know if you guys have ever hit your elbow anywhere and you felt that funny bone, right? What that is just a slight compression of that ulnar nerve, and you start getting tingling into your hands, and it stays like that for a bit, right? It's not fun. That's the same thing with this. Now, picture this compression for a long period of time as compared to what your elbow takes pressure, or you have you're hitting your funny bone. If this compromises that space, you'll be putting pressure on that spinal nerve, and you'll have that sciatic-like symptom down your entire leg, because that nerve will flow and will end up into the sciatic nerve, and that sciatic nerve goes down either the right leg or the left leg, depending on where that bulge. It usually ends up bulging out to one side, to the right, or it bulges out to the left, because there's a ligament protecting it right in the middle there. So that's the real difference, and that's the real risk that people end up getting they have a disc herniation or disc bulge. Disc bulge sometimes may push onto one of the spinal nerves. If it's a really significant disc bulge, sometimes it won't. So you may be asymptomatic sometimes if you have that disc bulge. Not as serious, much more serious. Then, like I said, there's degenerative disc, which is another condition which people, as you get older, unfortunately, one of the great things about getting older, these discs in between the vertebrae start to thin. A lot of that gel starts to come out, and you end up getting arthritic changes between the two bones. That's why it's very important to maintain a healthy back, because you can end up developing osteophytes and arthritis in the back. And that will cause all sorts of other back pains with that. That will also cause a facet joint dysfunction, which will cause stiffness in the back, not being able to twist or turn. That's when people a lot of times will complain about waking up in the morning and feeling a stiff back, then moving around and it feels a little bit better. It's because the arthritis, sticks those two joints together. It doesn't allow it to move until you get more circulation and starts moving around a little bit better. But one of the best things is to even avoid that type of condition. We'll go over exactly how you can do that. Scoliosis is usually something that affects younger people. It starts out in your youth, in your teens. Young girls can start out having scoliosis by their 11th year or 12th year. That's why we do, or schools usually do screenings for scoliosis. It's a lateral curvature of the spine. So the spine will actually look like this, or the opposite way. And people, if it's not corrected early on, it can really cause a lot of problems with not only that segment, but the entire back or the legs, and they can end up developing one leg shorter than the other, one leg longer than the other. Scoliosis and spondylosis, spondylolisthesis is just a forward movement of one vertebra in front of the other. So it's the shifting of the vertebra itself. But all these injuries and dysfunctions can either be prevented or they can be alleviated. Maybe not fixed 100%, but at least you can get relief from them if you develop those types of conditions. Some risk factors, like we talked about scoliosis, as you're growing up, can develop or can develop later on depending on what kind of activities you do. Decreased lordosis. So our spine has a natural S shape to it. The low back should have that C shape when you're looking at it. So an increased lordosis means that C shape is really, really augmented. So you're getting that increased lordosis that way. And you can see people that, sometimes will walk that way. And then you can have people that have a straightening of their back. That's a decreased lordosis. And both positions really will compromise the back. You'll end up getting not only back pain, but you can end up getting leg pain and thoracic pain, cervical pain, neck pain, things like that. So the natural curvature is the best because as gravity pushes down, it flows through the entire formation of that spine, not putting pressure through any other extremities, but through the natural curvature of that back. That's why we always want to keep this natural structure of the back. Social factors, age. For some reason, younger girls tend to get more scoliosis or diagnosed more with scoliosis. Usually it's because of the pelvis. Girls have a wider pelvis than males, and that they've shown has caused some type of condition that may increase the risk of scoliosis. Pregnancy can also, many people have said, increase their back pain if they have it, or bring on back pain if they have it, because now you're really increasing that weight through the lumbar spine. Other environmental factors, like the type of work that you do and recreational activities. And we'll go over that briefly now. So, these are some of the things that we can control and that we can prevent from getting back pain, or if we have back pain, prevent it from getting worse. So, maintaining proper posture. And I try to emphasize this so much with people because it can prevent a lot of issues with your back, and not just with your low back, with your neck, with your shoulders, and with your hips and so forth, the entire body. So what is a proper posture? Anyone tell me an idea what proper posture should be standing up? No, it's the natural curvature of the spine. What I tell people is try to draw an imaginary line from the top of your head through your earlobe, to your shoulder, to your hip, to behind the knee, to in front of the ankle. So it's kind of hard for people to really visualize that unless you actually stand in front of a mirror and you look at yourself and you try to make sure or try to visualize what that looks like or what that would feel like. A lot of times people that don't have that posture or have either too much of a forward head or rounded shoulders, it'll feel like a very awkward position for them. So that's why I try to get people to just feel what it would feel like to have that proper posture and to work on that. So that's one of the things that we can all focus on, to remind ourselves. Let's bring your shoulders a little bit further back if your shoulders are too far forward. Try to bring your head back a little bit more, or try to tuck in your belly a little bit when you're standing. All those small movements may not drastically cause a change in a good posture, but moving into a better posture will take off the pressure off your back. It may decrease any type of back pain. It may prevent any future back pain. I know sometimes I've had people just change the way that they stand, moving their shoulders a little bit further back and just being a little bit more conscious about that. Maybe not doing it all the time, but being more aware of that has actually taken a lot of their pain away, whether it's neck pain or back pain. So that's really important. Now, another question for you guys. Do you think, true or false, that fashion designers have people's backs and overall mechanical function in mind when they have their new lineup of clothing? No. It's actually the complete opposite. They care nothing about how well you'll feel wearing their type of clothes. So it's shown that, especially with women, because they're a little bit more fashion conscious, I guess, than most men, their clothes seem to be a little bit tighter, and tight clothes is something that can actually be detrimental to our overall movement. So tight clothes will actually prevent you from moving with your free range. So if you're wearing very, very tight pants and very, very tight shirts and you're worried about things coming undone, you're going to move in a way that, you're not going to move correctly in the right position. You're going to have to walk and stand in a way that may compromise your back. So that's what I tell people. If you're suffering with back pain or if you have back pain, wear clothes that are a little bit looser on you, so it gives you the full movement, the full range of movement. And that's great for anyone, for keeping a good posture, good health. If you're wearing that maybe for a couple hours going out, that's fine. But if you're wearing that constantly, 10 hours a day, every day, it's going to have an effect on you. Another big thing, I know women are really going to get me on this one, is the height of their heels. That's another big problem, because the higher your heel is, the more lordosis you'll end up getting in your back. So if you have a 5-inch heel, and I give ladies a lot of credit for doing it, because I don't know how I could never balance on 5 inches, but it'll increase this type of movement in the back. So their back is going to have a lot of pressure right in this area over here. And over time, by wearing shoes like that a good portion of the day, 6 to 8 hours, 10 hours a day, standing, walking in that position, they will for sure end up getting some type of back condition or back problem in their not so distant future. So I tell people, try to wear a comfortable shoe. If you're going to work, try to wear a flat shoe. If you need to wear something a little bit more fashionable, which is fine, wear it when you get to work. If you're sitting down most of the day, just wear it while you're sitting, or if you have to make small passing movements, that's fine. And when you leave, put on some comfortable shoes again, flat shoes, so that you're able to get to your destination if you're doing a long walk. But the worst thing to do is to stay on them for a long period of time, because it can compromise your ability to be in good health. Ergonomics is also another good thing and something to keep in mind. One of the things that affects people at an office the most is the way that they're sitting, the way that they're standing, or the way that they're staring at the computer screen. I don't know if you guys remember, the first thing that I talked about was the amount of pressure that somebody puts through their spine while they're sitting. And I mentioned before that people can put up to 200 pounds of pressure if they're sitting in this type of posture here. So you're putting so much pressure on that spine, 200 pounds of pressure. Now that pressure is alleviated by 100 pounds just by sitting in an upright posture with your back straight. And it's even better when your feet are elevated. It can even drop down to 50 pounds on your back. So that's why this position here can cause a lot of problems. Even the slouched forward position can cause a lot of problems because of the amount of pressure that's put on the back. So again, the proper ergonomic position, your eyes should be at the first third or the top third level of the computer screen. Shoulders should be at your side. Your wrists should be neutral, your forearms supported, if you're typing. Your legs either parallel to the floor or slightly elevated, and then your feet rested on some type of support. They've shown through several studies that that's the best position, at least for your back, for your shoulders, for your neck.
The feet
Yeah.
are angled.
They really haven't shown too much of a difference. They said as long as you keep it elevated for about an inch or two off the floor, that actually takes a little bit of pressure off the back. It could be angled if that's more comfortable. It's more of a comfort level at that point if you want to do that. And the last thing is when you're lifting things. And like I said before, I see people lifting the wrong way all the time. You want to use your major muscle groups to start lifting, not the spine, not the skeletal structure. So if we're lifting anything, the main or the larger muscles of the body, like the quadricep muscles, the hamstring muscles, the leg muscles, they should be taking a lot of that weight. So if we're going to lift anything, using your legs to squat down, keeping your back always straight, keeping any object close to your body, and then lifting back up. And if you're picking up something as small as a pencil or a piece of paper, that can also have a detrimental effect if you're not doing it correctly. So what I tell people to do, if you don't want to squat every time, hold on to something and swing your leg out, keep your back straight. Lift up what you have to lift up, as long as it's not heavy. And then go out and do what you have to do. Again, that's a vital way of protecting your back. That's one of the most important things. That's where most people come in because they're lifting something the wrong way, or either sitting in a compromised position. Okay, well, those are just some conditions, and I think Lillibeth will continue with, if you have back pain now, what do you do to treat it, and what can you do to get better from that back pain? So you know more back pain.
Hi, good afternoon. Just want to make a little move from here. I was just telling my colleague, I'm not used to talking to public. So I'm kind of a little nervous because when you don't speak English, what's this, fluently, it makes me more conscious when I speak it. So just bear with me. But I'll try my best to talk and be able to relate to you the information. Okay, but before we do that, okay, I just would like to also add an additional information about your questions. Okay, he was asking what is the difference, right? Okay, if you will look at it, if you will get the information from your MRI, remember, you will read there bulging disc, protrusion, exclusion, sequestration. What are these? Okay, so if you will look at it just a while ago, sorry, just low. So, that's fine. Okay, in the middle of the disc, okay, in the middle of that, there's a small disc called nucleus pulposus. It's like a gel one. Okay, at the side, we call that the annulus fibrosus. Basically, this nucleus pulposus and the annulus fibrosus are basically the absorbing cushion in between the bone. Now, what happens when there's a bulge? This nucleus pulposus kind of like bulge a little bit, but as Michael said, it doesn't really destroy the ligament surrounding that, which is the annulus fibrosus. Okay, so sometimes you can have asymptomatic, you don't even have any symptoms, but sometimes it depends on how bad it is that you will have. But then the other one is the protrusion. What happens is with this nucleus pulposus, with the nucleus pulposus, right, when it protrudes, it actually goes a little bit out and kind of destroys the annulus fibrosus, but not much yet. And in front, okay, at the back here, if you will look at the back here, at our back, there's also a ligament surrounding the spine, which is the posterior longitudinal ligament. Okay, what happens if you will look at that? If you will look at the anatomy of our spine, in the front it's more thicker. So there's more. So that's why you're wondering, how come we have mostly back pain more than severe pain? Because the ligament that is surrounding in front of the vertebrae are thicker compared to the back, which is the posterior longitudinal ligament, which is thinner. That's why every time you bend, it easily gets pushed. So that's the protrusion. So again, bulging disc, that nucleus pulposus will come out, but doesn't destroy the annulus fibrosus and the posterior longitudinal ligament, which is at the back. When with the extrusion, it started to come out. Okay, it started to come out all the way to the annulus fibrosus. Okay, but still basically like that. I'm sorry. So with the protrusion, extrusion, with the extrusion, the nucleus pulposus started to go out and started to destroy the fiber, which is the annulus fibrosus. Now with the sequestration, it totally come out basically here. Totally, there is already a fragment that is out of the spine. That's why it compresses more on the spinal cord and the nerve. The sequestration, okay, and the protrusion. Protrusion, okay, it comes out already from the center of the nucleus pulposus, but it doesn't destroy the posterior longitudinal ligament and the anterior longitudinal ligament. Extrusion is started to destroy the second layer, second circle. Okay, the sequestration is started to come out. There's already a fragment coming out, which even causes more compression on the nerve or even the spinal cord. Okay, so that's one thing. Okay, now let's go now to the treatment. Okay, the treatment of lumbar spine. Now, as what we have said, the treatment that we will be giving here is basically basic stuff. Okay, but this is just baseline that we want you guys to follow. But it is still different if you see doctors, physical therapists to be able to really assess you the way what is really going on with your problem. Okay, now, one of the things that we recommend is proper posture. Now, why proper posture? Just Michael said, sitting is very important. In fact, one of the things that we have to consider really is the height of the chair. Because as what Michael explained a while ago, if you're sitting incorrectly with your feet, with your knee even higher than your hip, that also causes pain on your knee, more pain on the back. So those are things that we have to remember. Standing, same thing with standing. Michael already explained it to you. Walking and even exercise. So if you will look at it, people just go do their exercises. But always remember, if you're not doing your exercises properly, you will always hurt yourself. Okay? So I'll give you an example. People, when they're doing their exercises, there was a study done that how come in all the patients that they have, a lot of patients that are going to actually patients going in the gym, and what we found out is that a lot of patients that are going to the gym are just doing everything because they're not doing it properly. In fact, one time I went to the gym also, and I saw a lot of people doing exercises, things that are aggravating them more because they're not doing it properly. Another one is, if you look at it, you see some people doing so many difficult kind of exercises, which is actually aggravating them. Okay, when you see people they're jumping more, doing higher level of steps, jumping. In fact, there's a strength conditioning exercises that I went to, and they said, if you want to strengthen yourself, you really don't have to do complicated exercises. Doing exercises that are very simple and correctly executed will actually be even safer compared to doing so many complicated exercises just for the sake of exercising. Will actually give you a lot of back issue or any other problem that would cause more pain on your back. So another one is sleeping. Okay, what do you think is the best position in sleeping? On your side. What else? On your side. Okay, basing on research, the best position really is in sleeping is supine. But we will talk more on that because if you will ask people, they said that laying on the back still give them problem. And I will tell you why. First of all, the best position is sleeping on your back. Second is on your side. And the third, and which is the worst, is laying on your stomach. Now, what's the reason behind it? Okay? If you will look at, I always tell my patients, first of all, let's go to the worst position. If you're sleeping like this, right, what happened to your neck? It'll rotate, right? So when you're sleeping on your stomach, your tendency is, because your bed is like this, tendency is to rotate your neck. And prolonged position of that, when you wake up in the morning, what happens to your neck? Stiff, and you have sometimes you have what's called that spasms, right? Stiff neck. And then you have to remember, prolonged activity or prolonged sleeping on this position for a prolonged. You may not feel it. Let's say people say, "Oh, I've been doing that for a long time." Yes. When we are young, our body's ability to absorb shock are still good, very good actually. Because when we are young, our body's ability to heal is better. Why? Because our immune system are still strong, are still healthy, and their ability to repair is faster compared when we get older. Now, as far as immune system is concerned, we will talk more about that, because immune system actually, recently they have done another study that they were finding out why back pain is still there, even though you have the back pain for so long time. And in fact, immune system has something to do with it. Now, another one is, so what happens when your neck is rotated like this, tendency is you're also compressing a nerve. For anything, and then this is also considered as aggravating activities, okay? Anything that you do for a prolonged period of time, you develop what we call wear and tear problem, okay? So, and then always remember, there's even a study done that when you have your nerve compressed for a longer period of time, even the cause paralysis, it depends on how long it is. Okay, another one, remember there are people that when you sleep, okay, you notice, okay, when you sleep like this, when you wake up in the morning, right, everything is numb because you're compressing on the nerve. Everything seems to be numb, so that's why I even advise you to avoid that, okay? So sleeping on your stomach is not a good thing. And then what's happened also. So when you're sleeping like this, if you would look at that, there's a spinous process that sleep. Tendency is to hyperextend. Okay. Now on this side here, we call it the facet. On the facet, in between that, there is no cartilage holding the bone. So see this one here? So when you do that, it compresses more of the facet. See that? And considering that there is no cartilage covering protecting the facet, its threshold to pain is higher. Okay? So constant, and then as we get older, especially if we develop already arthritis or osteoporosis, the more compression on a bone to bone will actually cause more pain. So that's why personally, every time I have my patient, I learn my patient, they're sleeping on their stomach, I always tell them, it's okay if you want to do that, but I always advise them to start, first of all, I tell them, if you have a bed just like what the treatment table we have here where there's a hole, it's fine because you maintain your neck in a straight position. And I also recommend put a pillow in between the hip and the stomach. Start with that. But I do not tell them to continue with it. I tell them little by little, I want you to start transferring to side lying. Probably start with 30 minutes, depending on how your tolerance, and then also 30 minutes, and then just decrease the time. Okay? The next, pain and anti-inflammatory medication. Now, any idea with pain and anti-inflammatory medication? Usually what happens is we have a lot of pain, right? Sometimes even though we're doing exercises, pain is still there. So what we really recommend is, we don't do that, you probably know that doctor would give pain or anti-inflammatory medications. They're very important, especially if it's debilitating you already. If there are activities that you cannot do anymore, it's always good to have pain or anti-inflammatory medications. It will not cure the problem, but it will help with the pain. Okay, it will help with the swelling as well. Okay, now physical therapy. Now, the most important thing you have to remember is that sometimes taking just medication is not enough. You have to do several areas, and one of them is keeping your body healthy and keeping your body really ready for all the shock absorbing activities that we do. And what are these? General conditioning. Basically, we give you a lot of exercises for the abdominal, especially the abdominal. Always remember, your abdominal is the powerhouse of your body. If this is weak, okay, everything crumbles. From here, it will affect your neck, it will affect your hip, knee, and feet. Okay, so that's why this is very important that you work on your abdominal strengthening. We call this the powerhouse. It's just like the foundation of the house. So work on that. Now, I will be showing you later what exercise we can do later with abdominal. Then of course, physical therapists will be able to do, if you have some herniation or any, through physical therapists, they will, because you have to remember, there are certain exercises that like for example this one. This is very good for this extension, which is the pronapse. This is very good for people that have herniation. However, if you have a stenosis, this is not recommended. Although our goal is for you to be able to do that again pain-free. So that's why it's really very important that you see a physical therapist as part of your regimen to be able to really help with your pain. Now, strength, that's include, of course, we will be doing a lot of strengthening exercises with you. And stability. Stability, basically, stabilization exercises for the back. Okay? Then modalities, which we will give you hot pack, hot pack, ice. And then actually, now with regards to anti-inflammatory medication and also for the modalities, don't you know that ice is very good for inflammation? Okay? Sometimes people say, no, we don't like ice because it's burning. Okay, I want you to remember this one. Based on research again, this is actually evidence-based. They found out that comparing heat and ice has better result. Now, if you look at heat feels good. Why? Because it's therapeutic. Okay, it feels good when you put it on. However, if you have swelling, always cater on the swelling first. And what you will do, ice. Because when you have swelling and you put heat, you dilate and you facilitate more swelling. That's why you have more pain instead. Unlike if you put ice, it constricts it. So it doesn't make the swelling worse, but it will numb it. Now, always remember there are stages with ice. Because some people don't like ice because they said it's burning, it's aching. Okay, first stage of ice. One is when they put it on you, it will feel burning. So when you feel that, don't get scared. All you have to do is put additional towel so that you will avoid that burning sensation. And then after that, you don't like it because it's cold. Same thing. Put additional, but that's a part of the stage of the ice. It will be burning, cold, the second stage, and then the third stage is it's actually aching. But don't get scared because the last part, which is the end part, the end stage of the ice is numbness. It will numb us, which is our main goal, which is to numb it. So, and then I will give another example. I don't know if you are familiar with one of the football players that had a great cervical, he was playing, I don't remember the name, but I saw it in the news. He was playing football and he hit his head in one of the players. So basically from C2 down, he got paralyzed. Okay? It was affected from C2. So what happened there is that during the time that the ambulance was delivering him to the ambulance, ambulance, okay? Okay, the doctor was there and he was still conscious, the player was still conscious. And then the player said, "Doc, do everything to help me." And then the doctor said, "There is a treatment that we are on study now, which is not yet FDA approved." Okay, it is not yet FDA approved, but it's like a gel that it is like an ice at the same time. but the player said no, do it. So he has like a consent for the day. So the doctor did it. And just because of the treatment that it, because it's eyes, it makes it basically what the effect of the injection that the doctor did is that it prevents the swelling along the spinal cord. So because of that, it prevents swelling, and because of the swelling decreases, and it did not get worse, it protects some of basically the nerve. And amazingly, from a C2 damage, that is every time you have to remember, anything damaged here going down is really worse. But with him, you'll be surprised from C2 he's still walking because of that. So that's why. But again, you always remember every individual is different. Okay. Now.
A question. On average, how long over time period do you let the ass?
15 to 20 usually is that. Yeah, as long as you don't how do you call that? Just basically as long as you can tolerate the temperature. And don't do it also too cold. Especially, okay, I will give you an example. If you're going here, let's say you put your knee here, don't do it like, because some people do it like an hour, okay? Don't do that because there's also a nerve here, and sometimes prolonged use of ice is not also good. So always remember that there's always a saying, anything too much is not also good, right? So anything less is not also, so it's always good in moderation. Now, let's go to pain management, which is injection, okay? Some people, usually what happens is, you're probably wondering, how come I did everything already, but the pain is still there. So that's the time doctor would recommend pain management or injection. Now, you can always ask the doctor about it, or ask about the side effects as well. But if you cannot function anymore, pain management is a good thing to do. But again, as I've said, it's always a choice between you. There's a saying, you have to be proactive on yourself and ask for the side effects of the pain injection. Now, bracing, sometimes, like when you have a lot of back pain, abdominal brace would also be good that you can use for the meantime, okay? And then let's say you did everything already, and then still the same. There's no progress. Surgical intervention is advisable. Now, this is not our expertise, but I will give you a little bit more information. And is there anyone who's a doctor here? Probably can share. And then Michael, if you want to also you just add. Okay. Scoliosis correction. Now, people with scoliosis usually they have the curvature, right? There will be a time when you probably saw people with scoliosis, right? Usually, when you have scoliosis, when the angle of the curve gets bigger, the tendency is they compromise the lung area. So you will notice people with really, really bad scoliosis, they cannot breathe anymore. So that's why we recommend, if you have scoliosis, make sure you do a lot of stretching and a lot of breathing exercises as well. Now, and if you will notice, when we do the bracing, when they do the correction, people with scoliosis will have increase in height. Okay? Now, another one is laminectomy. Okay, laminectomy is actually, if you look at this, this is the lamina here. Okay? What they usually do, they usually cut the lamina here to be able to decrease the pressure on the nerve. Okay? What happens is, they usually do this if it's an emergency. Okay? When the symptoms are that there's already numbness on the leg, there's already tingling in the limb, and it's been, patients cannot walk anymore. Okay? So another one is, now there's another one we call microdiscectomy. The surgeon usually removes a small part of one of the facet joints. So this one here, okay, basically here, what they do is the same thing. They facet joint between the two vertebrae to relieve pressure over the nerve. The nerve root is then gently moved to one side, and part of the intervertebral disc pressing on it is cut away. So what they do is they remove the facet joint, okay? They cut it away, And what they do is they move the nerve away from where there's pressure, and they try to remove the disc that is protruding. That's what they do, okay? Now, when you see fusion, okay, fusion actually what they do is when they remove a bigger amount of bone on the spine, what happens is when they remove a bigger piece of bone, there's no more stability on the joint. So what they do, that's the time they fuse it. Okay? Now, if you will look at the percentage of herniation, okay? There's a lot of herniation going on. 90% occur in the lower spine. Okay. L4, so that's why one reason why people, how come there's so much back pain more than the neck pain? Because actually, this is more L4, L5, L5, S1. It has more occurrence of back pain. Now, with regards to the neck, okay, we have the fourth 5. So basically, this is 7. This is 1, 2, 3, 4, 5, 6, 7. So the most common herniated area in the neck is basically from C4, 1, 2, 2, 3, 4, C5, C6, and C7. Those are the very common area of herniation. That's why they tend to use that, okay? And then in the thoracic, it's on the 8 and 12. So at the back, basically on the upper back, there's not a lot of at the back, there's not the upper back, which is the thoracic, there's not a lot of compression going on or herniation going on. Okay? Now, what are the benefits? The compression, basically same thing. They just remove the pressure on the spine. Okay. Now, what are the benefits of having a surgery? It basically helps with the pain, the tingling sensation, the numbness, and other symptoms associated with compression of the spinal nerve with the spinal cord. Okay. Now, what is the risk of surgery? So probably you'll be wondering, do I have to go for surgery? Usually, if we can do it conservatively, do all the exercises first, okay? Do a lot of core strengthening, and one thing you can also do is actually nutrients, which I will tell you more. What homeopathic and vitamins will do to be able to help you have a better joint, okay? So now there's a saying that when you have a surgery, okay, the risk there can be a little considered cerebrospinal fluid. But what the doctor usually would let you do is they will just let you lay on the bed, basically immobilized there for 2 to 3 days, okay? Or 1 to 2 days until the lid seals, okay? Now, usually when there is a nerve or spinal cord damage, there is bowel and bladder incontinence and paralysis, but very rare, okay? So again, okay, go back there.
On the right picture.
Okay. This
That's
one?
exactly what happened to me.
Mhm.
See first one.
Okay.
Tell me the long-term effects and how it will work.
Okay. Did they fuse you?
Yeah.
Okay. So usually you have to remember the reason why they fuse you is because they probably remove a bigger amount of bone, and because of that, you lose the stability of the joint. To protect that, they have to fuse it. Okay. Now, the main thing is when they fuse you, you have to accept the fact that you will not be able to move normally as you are before. However, always remember, when you have surgery, after surgery, always ask the doctor, when am I going back? When am I going to have my therapy? Because your body, especially in the first 6 to 8 weeks, that's the time your ligament, your muscles are healing. What happens is, if you don't do anything, you'll get stiff. Okay, I'll give you an example. If I am just moving my neck this way, okay, as it heals, my ligaments are just used to that kind of range. If you go to physical therapy must that when you had a surgery, the first 6 to 8 weeks actually, that's the most critical and the best time to be able to go for therapy, because as the therapy stretches you, your ligaments adapt to it. Okay? It adapts to the amount of stretching your therapist is doing. So let's say your therapist is doing this one, okay? Your ligament, because it's healing, it's still receptive to the range of motion. Now, it is you that will always give the therapist feedback. When we work on you, we can feel it. We can move it more. Because and we also feel it when that's it, that's the end range. So we will stop there. However, there are some patients that even though we feel that we can still move it, they cannot tolerate it anymore. So with you having it's always a how long have you been in therapy? 4 months. And so far, how's your symptoms? If you don't mind me asking. Okay, good, perfect. So that's why it's really necessary that you really be consistent with your therapy. And I have to tell you, there's one patient of mine also had a fusion. So far, she's been very consistent with her exercises, with her strengthening, and she actually gets the full range of motion. Okay? No. So it's amazing. I think not with the rotation, but at least the bending is pretty amazing. And no symptoms so far. So it's just really important that it's a matter of proper timing. Don't wait. If you didn't have a professional to help you immediately after if you decided to go for surgery, do that. Okay?
Something like that is a permanent surgery. You can stay in my body.
Okay. Usually we are
Especially what are the long-term effects of cushion over time and that?
yeah, that's one thing. Okay, this is one thing I will tell you. It's not the same. Always remember when you have a metal implant on the body, these are foreign objects. And once you have that, it will never. I have to always tell my patients, it will never be the same. But that's why I always tell them, make sure you always make sure you continue with your exercises. Now, in terms of a long term, people, this is because always remember every individual has different way of living and different kind of problem also in terms of surgery and different method of surgery depending on what the surgeon did. What we recommend with you is that continue, as I said, continue. Now, as long as the long term, it depends also on you. If you are a person with a fusion and then you started doing jumping, you can have a bad result after that long time. Okay, so that's why I would always say, always be careful. The main thing is listen to your body. If you are we don't recommend, personally me, and Michael wanted to add on that, personally me, if I have a patient with a fusion, okay, I'll tell them just, the main thing is listen to your body. However, do whatever you can do, as long as don't do anything that would aggravate it, especially a lot of pounding, avoid that. A lot of immediate twisting, especially, actually, one of the things that you have to remember when it's on the time of healing, we don't recommend it's just the BLT basically, a lot of bending, twisting, those things you have to avoid first. So those things, that's why it's really very important that you see a professional who is in line of that practice or in line of that particular problem that you have. Okay? And Michael?
Yeah, the only other thing that I want to mention with the fusion is that keep in mind that that section is huge, so you'll have the section or the level above and the level below that you're going to have more pressure in those two areas because there's no movement in the middle, but there's probably going to be more movement on the level above. So those are more prone to injury. So the best thing, like Lily was mentioning, is to keep up with exercise program to build up all muscles. Now I'm not sure you had your neck cervical or is it cervical? The lumbar, elbow. So the best thing to do is to work on a lot of core exercises, a lot of abdominal exercises, because you probably have more of a tendency of getting an injury later on to another level. So making sure that whatever exercises you're doing are safe, and that your therapist is going through certain exercises, and then continuing with them on the long term, making sure your flexibility, that you're stretching correctly, that you're exercising correctly, and that you're not doing any type of activity, heavy lifting
Okay, another one. Okay, another one is abdominal strength. Okay. Got it? Okay, another one is abdominal strength. Okay. Now, one of the aggravating activity that people do with exercises is this one. Okay. See, you will ask, what exercise can I do to strengthen my abdominal? Okay. So what they usually do is like this. Okay, which is wrong. I want you to remember, when you're doing that, imagine an apple on your neck, and then do this. Okay. Another way to strengthen your upper abdominal is just keep your upper shoulder down, and then just do this. Maintain that alignment from the neck. Okay. So those things that you have to remember. Okay. Okay. Begin getting into the habit of maintaining a neutral spine. So if you will look at your spine here, all you have to do is basically learn how to do the neutral position of your spine here. Okay, so everybody put your hands in here, and then just basically work on that. Okay, do the neutral position. Okay. Okay. And then we have to wrap up. So we will not be able to finish. And the most important, we will just home exercise need to chest, but the most important, okay, this is what we will just do since we will not be able to finish it. Just to talk to your therapist, and then they will show you what to do with it. And then also another one is eat healthy food. Okay. One of the things that they recommended is glucosamine, which is very good for our body. Now, there are glucosamine that look for glucosamine that are more on natural, like for example, the glucosamine, it's made of fish cartilage and also shell cartilage. So, but there are also natural base that are based on plant base. That's even better because your body absorb your when it's plant based, your body absorbs it better. Okay, so how much and how long can you take glucosamine? Okay, we can. Okay, I will answer you that later because we have to wrap up.
Right. Yeah, you can speak to your therapist. Lily's very good at those supplements too. One last thing, we were just offering this to people that were coming to the lecture. If anyone would like a back screening, we have therapists assigned today for anybody to come in for a screening to see what they can do, or what you need to do, what areas you need to work on a little bit more, maybe what muscle groups are a little bit weaker, and what needs to be stretched out. So at the end of the lecture, you can speak to myself, to Lily. Juan is one of our therapists, or anyone out in the front. So we're just offering it to people for today, or any day we have these lectures. And the educational series we have, like I said, the last Thursday of every month. Today just happens to be the back, but if you know about anyone that would like to know about any conditions that we discussed, such as the knee, shoulder, there should be an email sent out about what the next topic should be for the next month, for the last Thursday of the month, so you guys can keep yourselves informed about the other topics. But thanks so much for your time and being able to make that.
And then if you have a question, you can say it, and we can still answer your questions about it. Okay? So.
Alright guys, that was the WSPT University Lumbar webinar. Thank you so much for attending. See you next time.